Normally, the eye's lens is clear, allowing light rays to pass through and focus as they should on the retina. As a cataract forms, the lens gradually becomes cloudy. As light passes through this cloudy lens, it cannot focus clearly on the retina, and objects look hazy or blurred.
Pre-operatively, for review and clerking, start fasting at 12 midnight before the appointment date. To take own medications on the day of the appointment. Be punctual for the appointment. To bring companion in case of extreme ages or limited language preferences. Patient are advised to perform lid scrub 3 times per day until op day.
Put a few drops of the Johnson & Johnson baby shampoo onto a container. Then mix it well. Use a clean cotton bud. Make sure the cotton bud is clean and immerse the tip into the container like this. Step 1. Ask the patient to look upward to clean the inferior eyelid. Look upwards. Use one finger, look upwards, and clean along the lash line from the internal part of the eye to the external part of the eye without touching the eyeball. Repeat the step 2 to 3 times. Step 2. Ask the patient to look downward to clean the upper eyelid. Lift up the upper eyelid and start cleaning along the eyelash line from the inner part of the eye to the outward along the lash line. Repeat the step 2 to 3 times.
Risks and complications of surgery. Every surgery has its own risks and complications. Complications that are serious often require immediate treatment. Complications can occur during or after surgery. Following are the risks and complications that can occur but are not limited to. 1. Related complications. Local anesthesia, for example. Injury to the eyeball. Injury to the optic nerve. Allergic reaction to drugs. Systemic reactions that can lead to death. Risk of general anesthesia. 2. During the surgical procedure, there is chances of tearing of posterior capsular rent. Loss of vitreous loss. Unstable capsular bag. Dropped lens fragment. Ocular tissue injury. Hyphema. Suprachoroidal hemorrhage. 3. Postoperatively, there is chances of increase in intraocular pressure, intraocular. Macular edema. Retinal detachment, with a higher incidence rate among farsighted patients. Endophthalmitis. Capsule opacity, capsular bag opacification. Complications related to intraocular lenses, such as malposition or dislocation. Chronic uveitis. Unexpected refractive errors. Visual disturbances, including glare and halo. Exacerbation of pre-existing eye conditions. Sympathetic ophthalmia. Unachieved surgical objectives. It's important to note that some of these complications can lead to blindness even with adequate treatment provided. Postoperatively, avoid rubbing your eyes. Refrain from touching or rubbing your eyes to prevent any irritation or damage. Use prescribed eye drops. Follow the prescribed schedule for applying eye drops to aid in healing and prevent infection. Wear protective eyewear. Shield your eyes from dust, wind, and bright light by wearing sunglasses or protective glasses. Rest and avoid strenuous activities. Allow your eyes to rest and avoid activities that strain your eyes. Attend follow-up appointments. Regularly visit your eye specialist for post-operative checkups. Use the plastic eye cover, given after surgery. Avoid water entering the eyes while washing hair. Discuss with the doctor if it is safe to drive. Avoid bright light and swimming. Intensive treatment is needed if there's an infection. You should immediately see a doctor if your eyes become dry or itchy. Your eyes become red and swollen. Your eyes are painful. Your vision suddenly becomes more blurred.